I'm going to start recording.
All right, call the meeting of the Parkview Health Center Committee together at 3:30. Item number 2 is approval of the July 14th, 2022 Parkview Health Center Committee minutes.
I'd like to make a motion.
Second.
Yeah, as long as there are no corrections. There is a double entry and the committee members. Okay, and Miss Puppeteer spells her name different than I do.
Okay. I will note that.
Otherwise, they're good without correction.
Anything else?
No.
Okay, all in favor of approving the minutes as adjusted, say aye. Carries 4-0. One abstention. Okay. Item 3, public forum. We'll open it up to anybody from the public who wants to speak. Discussion is limited to items listed on the agenda. Doug, does a person on Zoom like to speak?
She looks like she's connecting to audio.
Well, we'll move on. If you wouldn't mind just checking back with me in a few minutes.
Sure.
Come back to that.
Okay.
All right, we'll move on to item number 4, financial.
So for month of July, where the percentages should be around 58%. And we are running just a bit behind that for our total revenues. We're at just over 51%, it's 1.6. The intergovernmental is about normal. Private pay is down a bit. We have had a little bit of a issue with some billing that because of Tom's he was the login person for one of the entities, and to actually get him off, they had to recreate our whole account. So it didn't allow us to do billing for almost 2 months. Yeah. So, but we got that finally figured out and fixed, and we just did a bunch of billing this week. So that should bump that back up again. And the food service is the what we're selling to the crisis center. So it's a little less than what we were predicting that we were going to do, but we're doing close to about $1,000 a month now at this point. For labor's running behind or less than the 58%, mostly due to the fact that the 2 units were closed for the most part, and we weren't staffing those. We are down a bit in some of the other areas too. The food service and housekeeping were down a little bit. Travel, we did, a good chunk of that traveling at the first part of the year. So I think there's a leading age conference that's coming up that will probably be close to using the rest of that up. Capital improvements. This is just what we have left in the revised budget column, the 104,000. That's for the dishwasher, and that is part of the budget transfer that's going through because it came in a lot higher than what was budgeted originally. Otherwise, nothing really standing out too much. There's a few things that are over, but it's not over by a lot or a big dollar amount. One of the bigger items is the professional services. And that actually is running behind what we did last year. So that's actually better for us. So we're not running in as to as many staff nurses from outside. And pretty much that's about it. So you can see at the bottom, the deficit of 1.28 million is where we are right now. We had budgeted a deficit of 3,293,000. For the 58% of that, that's the 1,895,000. So we're running about 600,000 better than what was budgeted. So that's pretty much about it for that.
Would you say that in the year or after every auditing that everything would be given back money or?
No, we won't be getting, no. So we budgeted using our fund balance. If we don't spend what was budgeted, the 3,200,000, then it just stays in our fund balance. So it's just, yeah, and then that can be used going forward. No, actually the fund balance, it's hard to tell because we still haven't got the final report for 2021. So all the adjustments for 2021 haven't been made yet. I'm guessing it's going to be around 5 million. I mean, that's other than capital, part of the fund balance.
And that money can only be used for anything related to Park View
Yes.
capital.
No, it can be used for any. So the capital is the cost of the buildings, less depreciation. So
Is any of
it's
that rolled, any of the grant money rolled in on top of into your fund balance?
which grant money?
Well, you've had grant money for the ancillary building. I know of that.
No, we didn't have any grant money. That came out of fund balance.
That came all out of fund balance?
Well, 600,000 out of fund balance, and then I think there was a transfer from the general fund for 700,000. I think.
We applied for a grant.
We
Yes,
did,
yeah.
but we never got it.
We never-
Yeah,
That was
that didn't come through.
November,
Yeah,
and they were going right tight to the wire to
Yeah.
get that, and I thought they did that.
nope, that didn't come through. So it was.
You said in there.
Have you had your budget meeting already?
No, ours is pushed back to September 6th.
September?
Yeah.
Oh,
You have it with the executive. You have it with the executive.
That's the executive meeting is
Yeah.
September 6th. Yeah.
They're having, Ms. Abbott, they're having all of the executive meetings, the end of, this month and into September, but they're all meet and greet the executive kind of thing, where they sit down and they go over their divisions.
I get that, but August is always the time because I give you time to get to the.
They are meeting some right now.
Yeah,
They're appointed tomorrow.
I've been to two of them, and I'm sure there, there's four of them going on, and going to another one tomorrow.
I talked to yesterday, judiciary today, and a member, I asked her yesterday, so. Fine.
Yep.
I think probably the better rationale as to why that would take place in September is probably to align with starting the new director of parking.
Oh, yeah.
That makes a lot of sense. That would be my-
I know that right now. Good job.
I do have a question, but I think you're gonna get to it on item 8 in your agenda, so I'm just gonna be quiet for now.
All right, I have one question. You talked about the wage turnover savings. I think that was a relatively new addition to this department's budget. Is that correct?
Actually, this is the second year that it's affected our budget. Well, the prior year, it was, I think they had budgeted like 300,000 of savings. And this year it's the 500,000 in labor and 500,000 in fringes.
We haven't used. What I.
Well,
How does that?
so what that it means is you budget all of your people that you are on your table of organization. So if we budgeted everybody, they're at the $10 million. We're saying we're not going to fill all of those positions this year. So we are actually able to save 500,000 off of that number because we're not going to be filling that much. This next year is going to be a little bit different.
So if you actually ask this way, is that what we did in a year? Does that seem like it's going to be an accurate number, or is it much higher?
Well, I think we'll actually have more savings than predicted, more savings than the $1 million, because right now we're at 47% of our labor budget, and that's figuring in that $1 million savings already. So we're probably running, last year we were at $8 million of cost. This year we're at 7.4 million. So we're running lower on our labor than previous, and so I would guess our savings will be in the $2 million mark area.
So, I don't know, jumping ahead, we don't get a report, we get a report not every month, but every 2 months about staffing and how many positions we have, and that's what makes up what you said. I mean,
Don't you have?
what happened, in March or April, and then where did that money come from? Money is already taken out of the budget for it. It becomes, we heard, more funds next month. Like I say, it's too much to ask for every month, every few months. Zero, I think to have some idea of how many people we have. And what I understand from the human services down there, the idea is so much too, that we didn't have.
So I'm guessing there is a for the administrator's report, it is in that number
Okay.
or in that section. So
We did the staffing, we get staffing with the other ones.
Yeah. Yep. So for the administrator's report, we are right now in a COVID outbreak situation. We actually have, I believe, 11 residents on our Woodside 2. Yeah, we just starting, and pretty much all of that took place from last Friday through Sunday. We moved that many people over to our, from the regular units over to the COVID unit. All of them are doing relatively well. Minor congestion, light cough, stuff like that.
Sorry. Just the staff member. There's a lot of- there was one
I got it. I'm gonna see if on our weekly update that we get from Jessica, if it actually said how many staff. I believe when I was talking to Belinda this morning, it was I think 8 staff.
That have COVID?
Yes. Right.
Does anybody wear a mask?
Oh, yeah, all of them. They have to. We wear masks religiously. So they're probably not getting it at work.
Yeah.
So
So how long is the quarantine for?
for the residents, it will be if they're I believe if they're unboosted, then it'll be 10 days. If not, so by the end of next week, they'll be able to come. Almost the full, if no more go on, everybody will be off by next Friday.
And they're all okay, correct? Or if they have vacation, sick time, and leave.
Yeah. Yep. For the staff, yeah. Residents, staff can be out, will only be out 5 days. For staff.
They're all required to be boosted. Is that correct?
They, well, or they have to test twice per week. If you're boosted, you test once per week. If you're not boosted, you test twice per week. Okay. So let's see. Oh, here we go. We're in outbreak, so no new admissions through 9/2 unless they're COVID positive. And the positive residents are pretty much, there's one from Parkside, one from Lakeside, 2 from Prairie Side, and 2 from Parkside, 2. So it's pretty much all over the whole building where we're getting them from. So then, so when we're talking, so the monthly average census for July was 119. We were up as high as 121. As of today, we're down to 115 again. We had, which was up from June and up from May, so we were heading in the right direction. There was 12 admissions in July and 13 discharges, and still 15 on the waiting list. The payer source, 19% private pay / VA, 69% medical assistance, 4% family care, 5% Medicare Advantage, and 3% Medicare. Staffing, so for the staffing update, we're looking at 43.8 CNA full-times, or full-time equivalents. 11.7 nurses, 1 food service, 2 housekeeping, and 1 administrative coordinator.
That's in addition to what you had last month?
No, that's the current,
numbers.
number out.
So we're looking for more CNAs, and when we process all of those resolutions through county board, that's on up.
Yeah. And survey update, no recent survey activity. And then for the project update, so I got a status this morning from Capella Dietrich. He said interior drywall has started, paint to start the first week of September. Exterior or excavator will be on site the week of August 22nd to remove asphalt and bring site up to grade. Utilities may be the second week of September with curb, gutter, sidewalk, landscaping, and asphalt to follow. The expected time frame for completion is week of October 10th. And
Yeah. Do we get a tour?
and I had not heard anything on the water heater replacement. I was supposed to get an update today, but I did not.
Want to go back to, or go to item 8, just for a second. What did you say that the dollar amount for the dishwasher
Let's see.
gonna be?
So that's what we had budgeted, 104,400 or 100,400
400.
is what we had budgeted.
And you need to have additional
Yes, 20,
29,
Yeah.
600.
because that was the bid that we had gotten from them last year about this time, so we could put it in the budget. We asked them to update it, and that was the updated price.
So they kind of added.
Yep.
Is this a brand new one off the
Yeah.
showroom floor? Or is
Yeah,
it something
well,
that they're waiting
it's
for
a-
to get out of China?
It's a 20-foot dishwasher,
Yeah.
commercial grade. Yeah,
No.
it's so.
All right, we'll move on to item number 6, regular discussion 2023 budget submission.
All right. So, what I have printed out, in a long packet of paper, that is all the different, budget categories for all of Parkview combined. And, on the side, there's, various remarks on what we, base those numbers on. So we budgeted for 90 residents for Medicare or Medicaid, Title 19. They usually give us a little bit of an increase, so we bumped that up, and so that's why the revised or the requested 23 is more than the projected 22. We budgeted about the same census as what they had budgeted last year. And that's 143 residents is what we're hoping to get up to by. So all of these numbers in in the budget are based on that projection.
43,
143,
oh,
143 census. Broken down in various categories. So, and then you'll see that if you look at page 2 in the wage area, we're actually bumping up that the wage turnover savings up to 1.5 million, because we think we can still, we'll still, even at that census, we'll still have enough savings there to allow for that. So our labor from what we budgeted is just a little bit under what we budgeted for 22, but we think that's still a viable number. Did not budget any, about the same for travel, same number as last year. The capital, we didn't budget any new capital this year. So the reduction of the 100,000 for the kitchen dishwasher. And everything else really is relatively the same as last year's numbers. Budget just a little down in our professional services, due to hoping that the training center and hopefully with the new pay rates and stuff, that will hopefully get a few more CNAs in, so we don't have to go out and get them from the professional services. Few licenses have gone up a little bit. Our computrition, that's our food service license fee, that actually went up by $5,000 this year. And that's pretty much about it. If you look at the bottom, so what the expense total is about 500,000 less than last year total. Our relative deficit this year is 3,484,000, and if we keep the same tax levy, and that was 960,000 this last year, that will leave us, and then you take out the depreciation number, that leaves us with applying about 1.8 million of fund balance, down from the 3.2 that was applied this year. So, so 3 million. Okay.
How much was the refined fund balance?
We applied $3,250,000 in 2022. If you look at, so if you look at, there's a page, it's like 3 in, it lists several different accounts, and then it'll gives a total. The first and then the first column is the 2023 department budget. It looks kind of like this. Yep. Yep, that's the one. So if you look at that, this is just a snippet of the bottom part of this. And so we take out depreciation because that doesn't have a budgetary effect. And then the top line is the transfer in tax levy, 960,000. You'll see that in there. So then that's where it nets down to the fund balance that we're applying this year is 1,876,840. Last year's budget was 3,250,000. 21 budget, we applied 2,950,000. 2020, we applied 3 million. And then 2019, we applied 1.7 million. So, but, and if you look at the tax levy on the top line on that 2019, we actually had a tax levy of 1,599,000. So our tax levy went way down. The application of fund balance went way up because we did have a pretty healthy fund balance. Now we're getting to the point where hoping that it goes the other way.
The levy is also reflected on, by the amount of net sale or net new construction
Well,
as far as
over
what you're using.
over the whole county, yes.
Right.
We don't.
So this year,
So they didn't give us any new levy. We had to stay within. And the levy targets, if you look at the levy targets for Parkview, 2022 levy was 960,000. Our target, 960,000. No increase. So. All right. Yeah, that's what our total for the county is. Yeah.
total,
And then the next couple items in there are our ad request. Things that we would definitely like to have added to the budget. But to come up with the budget we did, we had to pull some things out. So first item is our is a new it's an upgraded nurse call phone system, just the actual phones and upgrading the technology. We're using older phones that can only have an Android 5 operating system or older. This would upgrade the whole system, and then their new rugged phones that we would buy with them. So make it a lot easier or a lot harder for them to get dropped and broken like we're currently experiencing. And with the 100 phones, that would give us enough to, because what we're running into is right now we have about 60 phones, and there's not enough that nurses can use, and then put on a charger and charge up for the next group or two after that. So we're hoping that we can have 10 per neighborhood, 5 will be in use and 5 will be on the charger. And then when they're done with their shift, they plug those in, the next shift takes the other 5 off, can use those. And it'll actually make it a lot easier for them to keep up on all the calls. So that's what that one's about. Next one is the video streaming and audio for our great room, and then also our channel 15, so that stuff that happens in the great room can be projected out to the different TVs in all the different rooms. So if somebody can't make it down to the great room, they can actually watch it in their room. So that's what that ad one is about. Next one is we got a bid to update all of the caulking around the base of or around the outside exterior of the building, and helps with eliminate some of the ant infiltration that's coming into the building. And just helping keep out weather. So that's what that one is. Next one, we've had even last year, they had gone through, and during the budget time, they had talked about replacing the ambulance door and the kitchen receiving door because they were getting in rough shape. They ended up getting taken out of the budget last year, so we're hoping that we can get them put back in this year. And then we ended up having to pull out the wage increases for the that one is in the budget. All right. So the assistant director of nursing infection preventionist is included in the budget. But and then the next one, I've been notified by the facilities department that the outside mower that we own is starting to cost us more and more in maintenance, and they recommended getting this machine so to replace the one that's getting older. Yeah, that's correct. Not, I wasn't aware that this was actually a Parkview lawnmower. I thought it was just a facilities lawnmower, but they just notified me towards about a month ago that you might want to think about putting this in the budget. Like, okay. Yeah.
Do you know how old more is?
The mower is probably, I believe that one is, I think it's a 2008, I believe, the one that's we're using. And it's
Parks just buy one.
I guess we talked to Perks, because in my budget meeting, Adam brought up that one of our add-ons was a mower. Now, I'm sure, I don't know, Perk, yeah, usually a lot of questions summertime.
Yeah.
Perk was right here. I mean, maybe they can go together and somehow
yeah.
share that, and maybe.
Yeah, and I'm not sure size wise. I mean, the Parks one might be a lot bigger than what can fit around our building.
No, Well, we ain't gonna know, we gotta ask, if it's meeting, so, yeah.
Yeah.
Because I remember Dennis and then we remember.
where you buy one over at Park and they're looking for another one. Why don't you get together? And the double buy, you know, may give you a little bit of a, you know, a little money back.
That's what I'm gonna say.
Mhm. Yeah,
I don't know.
well, and usually we'll buy them off, we'll buy those off the state contract, so we usually get pretty decent pricing on all of that stuff for vehicles, yeah. So then the next one would be the therapeutic wellness coordinator. And then the one following that is the rest of the therapeutic wellness specialist. We ended up, we wanted to keep the title in our table of an organization as the new title, but we actually pulled out the pay grade raises. Because the title,
Took the money away from.
yeah, and then we're asking for that to be added on in the budget. Because we had to cut somewhere, and that's one of the places that we felt that we could do it.
What is that therapeutic wellness coordinator and specialist having to do?
So they're the ones that were here talking the last time.
Yeah.
They're doing the, oh, okay. So they're the activities people. So they coordinate all of the different church services and outside grill parties and stuff for the residents.
Tim Lauren. and
Yeah.
Elizabeth.
I think
Public
there was someone
Yeah,
out here that did that.
yeah.
Way back when.
They're, these guys have been with the county for close to 30 years now.
Mhm.
So,
It just has fancy name.
yep. They wanted to change the name for sure, just because it does describe what they do a little better. Yeah, activity specialist. So, yeah, it's,
That's what it was here.
yeah.
Yeah, so that was one of the things I wrote.
Yep.
I thought that's one of the things that we professionalize it, the training that we're for. Them and some of the different ones, a different one, we've got someone who has a background or activity, where they have a lot more knowledge and we have to go over communication and all that stuff.
It's my understanding that in the table, the proposed table of organization, title changes, job description doesn't change now.
That's correct.
Okay.
Just the title. Yep.
So this requested add-on
Is just for the wages.
for the
Wages.
wages and job description, right?
Well, the job description, what they're doing, they're still gonna do the same. It's just what they do is really described better by the new title.
So is there any change in under any scenario, is there any change in job description other than the name of the?
No, I don't believe so.
Kobe, I think they got the job description. I understood you to say that they changed the title and the job description accordingly, but they didn't put money with it. So now we've got to go back with some kind of a transfer to take money from labor and put it in with that job description.
Is that or did you not change the job?
I don't believe the job description itself has changed at all, except for it may be the actual supervisor has their description has changed a bit. Because they're overseeing a little bit more now. But the rest of it's, that's what that position is for. It's not increasing any type of workload for them. It's just paying them for what they're doing and what their education is about.
Thank you.
Mhm. So that should be all of the added requests.
I have a couple questions.
Okay.
If, Colby and the new director go and go and make their added questions not within the budget. If I or this committee wanted to do some of these add requests, could the non-operating ones be paid for out of the reserve fund or no?
Well, I mean, it can, but we risk running our fund balance pretty low. I mean, I think this is, we're still applying, 1.8 million of fund balance. I don't know how much more we want to apply of the Parkview fund balance.
I mean,
I'm hoping that it comes from elsewhere.
that's my thinking, because, if I make an amendment or we agree to make an amendment, of course, you could go, how you gonna pay for it?
Yep.
It's one way to be possible, right? Not only
Yeah.
possible. So let's think of that.
Yeah.
I
Yep.
can only do that, through the non-operational thing.
Yeah.
And my other question is, I don't know what's considered a capital thing. I don't know, some requests, are capital, like the, upgrade to the, I want to say the video or whatever, if that's capital or not.
It could be kind of seen as a capital. The whole project could be kind of considered a capital addition, an upgrade to our existing system. Whereas each individual item in there isn't really capital, but if you're doing the whole project, you could make a case for it being a capital item.
Shopping, I think it's $6,000 but,
Mhm.
And lawnmower, one expense.
Yeah, yeah.
Maybe if we give an example, maybe not so much the mower, but just talking, example, how bad it is and how needed.
Yeah.
We could make a positive that,
Yeah.
and then thoughts next meeting, determine how maybe we think about, as a committee, you'll have your meeting with the county executive, we'll get some more feeling, and we'll see how we actual budget, but maybe we would make one good amendment. Thank you.
Okay.
I don't have any questions, I have a comment. So, let's kind of make that comment about having a plan for, for the replacement of lawn or anything of such matter. In my previous world, that's what we did, is we created this plan. We're going to trade in all of our lawnmowers at year 3, that we had brand new lawnmowers. And, work that way.
Mhm.
I'm just wondering if we're, and you just said that in that situation.
That one, yeah.
You assumed that was.
The
someone else,
facilities,
not
yes.
ours.
Yep. We do that with all the computers. We have a schedule,
Okay,
and that's the majority of our replacement. That's kind of the reason that we want to replace the kitchen dishwasher right now, because it's 10 years old. not gonna last forever, so that's why it was put in the budget at this point, before it fails and then we don't have a substitute, so,
Usually,
so,
the life
Yeah,
expectancy of
on,
combines,
yep. So we'll be working on scheduling that out this year. Hopefully that I can,
This is true. This is the one. Another one. So we're gonna buy one, we're gonna have two on one. So, and that's trivial, and I'm more than it's good, but I think if we went to each department, we could find something like this.
Yep.
So what are we prioritizing? What is it costing us? And I'm just saying this, if we can't find people,
mhm,
if we had private service, mow their equipment
mhm,
and their people, what would be the difference? And so it's trivial for this one, but I'll bet you in other departments, we could find something like that before you know it, you have 100,000, 200,000. And not sure that work for you, but.
Yeah.
Because facility back charges us, right?
yes. And for, those are all temporary seasonal people that are,
Oh, they're like more like summer help?
yeah, that do the mowing for us. I do see that every couple of weeks, they'll send a slip showing how many hours were charged, for us. So if you look in the budget, I don't know if it probably doesn't show in this one. There is actually, some temporary labor, but it's, yeah,
It's minimal.
it's like $9,000
I guess my.
is what the budget was.
If we've got all these things we want to put back in, and we're one department. Maybe they should have been in there and put the budget together because this may not work, that you had to slim everything down, but then you're asking, and I don't mean just, but I think this is gonna.
Oh, yeah.
show up.
Yep.
And then you want all these things put back in, so. Well, what's the point of it? You know what I'm saying? Tight, but we like these 7 or 8 things, so if each department comes forward with that, the budget could get real interesting real quick.
Yeah,
This is why John Damel is categorically going down the budget with each department to itemize the needs lists for each department. I've already been to, 3 of them. I go to finance tomorrow. But there are viewpoints in favor of doing it this way so that he can pick and choose what he wants to go along with in that budget. But you have to have a list and you have to have an idea. So if it's going to be buy a mower rather than contract out for mowing, and it's treated differently in the budget when you take a look at how it's priced out and written off and whatever else. So.
But we've thinned down each department's budget by starting at flat.
No. You thin down by looking at the list of wants and flattening those out. The flatness is the directive originally on the budget, as how it was supposed to be designed. All the extras and add-ons are still extras and add-ons until you get to the executive review.
I get what you're saying, but I don't think it's gonna work, but whatever.
No, maybe I'll follow.
Are you on lawnmowers?
Yeah. You know, I'm old enough, running long enough, to asphalt, type, many years ago, maintenance taken out when we used to own a park up in Winnebago before we sold it was done the last 2 years by a private entity. We could do that. I guess I'm a little surprised that Earth Fuel is charged for it, but you still have to have the equipment, but it's so that. That being said, I'm gonna have to find out in the next 30 to 60 days, how much we're going to pay for that presentation, and who's gonna be responsible for finding the contract service and do that. And I'm not totally against it, you could do it, but is that the new director? Is that Mike Elder probably will, he's probably too busy, but that's what we could do. And that saves us money. A, we wouldn't have to buy more, that company would have to do it. And B, maybe we'd say we wouldn't have to.
It'll come out of your living. I mean, which basically you'd save it.
We have to have how much we willing to do that for the service, whatever, contract service, please, and do that in the next 30 to 60 days, but.
That would be an opportunity for you.
So it's not what I just said. It's one little iota of a big budget. And it's just something out of each. But I can see where we're going because it's going. Right. And it could be done with calling around, but yeah. Okay, and then we go on one.
My only other comment related to the budget request was, I guess, and I didn't, what's the age of the facility?
It's 2008 was when it was built.
Okay, so the caulking of the joints,
Mhm.
is that a whole facility?
That's the whole outside of the facility.
And is the rationale, because there's almost two rationales in it, age and weathering, which I'm considering one rationale,
Okay.
and then there's ant and bee issues.
Yeah.
in there as well. So those are solved in two different ways.
Well, but if you caulk all the open joints where the ant and bees are crawling in, then you eliminate
So,
the
so
the ant problem that we're experiencing at certain times of the year.
And I guess the question is, what is our bang for our buck? Because exterior work for caulking is can end up really quickly here.
Mhm.
And one, what is the sense of the product that's being used to caulk up the joints and how long that's going to last. And really, this is a very short period of time to be invested in caulking for essentially a very young facility.
Mhm.
So I know when I managed a public housing unit, that facility was going on 60 years. Of needing to the point where it was finally needing to be caught. So this is what you know. So just thinking about how do we make that determination?
Yeah.
Part of that is in the product when you're talking.
Mhm.
How long is this part of this job?
Mr. Chair, can I ask Bob a question? Have you ever dealt with the ground around the surrounding ground around the foundation as to whether it was drifted off, in other words, graded out away from the, or graded along a foundation, so it's uneven along the foundation? The amount of water that you get along a foundation through a rain that can't be handled by the guttering or whatever else, and the amount of rain that works itself up against the base of the foundation is a creation for this. And whether or not you have caulking done well, or you don't deal with the level of ground, in other words, the amount of ground all the way around the building, so that you have an even flow of water away from the building, all contributes to how long that's going to last. And in my mind, if in the proposal, they don't ask that question or want to ask that question as to how the grade around the building is being handled or going to be handled. Okay, I kind of have a wonder about whether or not the caulking is going to be the solution. Follow me?
Yeah,
So that's my,
So then here's my issue to keep this out here. When this building was, I want to say, the caulking contractor that did the original was called back because we had all sorts of, and now I'm not talking at the bottom, I'm talking on the Evis up here, okay?
on the soffit,
There were leaks.
of the soffit, at the top.
So my hearing was called that the caulking was defective, and they got Hamilton Manufacturer, who did the original, and they did it all for nothing, because it was defective, and Parkview was upset. Mike Elder was upset that it was a poor job.
Yeah.
So that was up higher than down at the ground. And a lot of issues that we had at the county, the people who did the original work.
Really?
Sometimes we don't get good contractors. But we stay under budget. And then we pay for it later.
Maybe we should look into how we're handling the contract when we're
So
buying.
even, and I get your point, and I get your point, but we got a problem.
I know.
So it's gonna cost us some money.
How long since we had a contractor in looking at it, evaluating it, or how long have you sat on the idea of caulking it, but we can't afford it this time, so we're gonna back it out of the budget
So-
for 2 years.
So this just came, the maintenance department actually had them, because we have had some woodpeckers knocking holes into the soffit. And so they had them fix that, and then at the same time they did that, they actually put the quote together for this, and that was about a month ago or a month and a half ago.
This is, I wouldn't have been doing. Yeah. We took that off, but, only the doors. Yeah. Okay, thank you.
So I have two questions, I think.
Okay.
Is, do you use the same or a different census basis for this budget from?
The current budget uses a census of 143, and that's the same census that they projected for the 2022 budget.
And correct me if I'm wrong, but it's been a while since our monthly average census has been 143.
Yep.
And we're likely to be under the same restrictions throughout all of next year that are probably, I know we could go up if we had, you know, if staffing was naturally fixed,
Yeah.
go up. But we also, some of the narrative it seems like I've heard over the last few months is that part of what's restricting our ability to increase the census is that we keep getting under, as we are now, COVID restrictions, where we get 2-week blackout windows.
Yeah.
If we're lucky. Last time, I think it was over a month, maybe, where we couldn't admit anybody who
Yeah.
wasn't COVID positive.
Yes.
So I think the question I have is that is like, how realistic, you know, I mean, is one, like, is there a scenario where we get to 143? How likely is that?
I think we went from 110 up to 121 within probably a month and a half. So if we stay, you know, it all depends on how the COVID, you know, if it keeps getting less and less severe, it seems like, that maybe they'll drop some of the restrictions and we will still be able to take admissions with a COVID positive. And we could easily open up, we have normally two empty units. We could open up one, that's another 21 residents that we could put in, and we would be up to the 140. Leaving one open for COVID. So I believe, there's no crystal ball, but I think easily that 143, I think, is doable.
So if we don't get there, we have good months.
Yeah.
we Drop a little bit or something, and we only end up at 130.
Yeah.
Is that difference kind of similarly affecting the income and expense side of the line?
Yeah, because we wouldn't need as many nurses or CNAs, so we wouldn't have to staff quite as high if we don't have the population. So it would be, it would be affected in both places.
It wouldn't
No,
doesn't blow the budget.
Yeah.
If this
Yeah.
Okay.
Yeah.
All right, and then the other thing I just wanted you to talk a little bit more about was the wages.
okay.
So 5.5% increase in regular pay. Is that an increase in FTE or is that a wage? Is that a wage?
That's the wage increase that was figured out by HR.
Okay. So we don't have the only change to the table of organization is a couple of title changes.
Was title changes.
Don't have
Yep.
wages behind.
Yep.
Okay.
Yep. That was all that was.
All right, that's all. Any other questions? Thank you all. We'll move on to item number 7, discussion and action, private paid rate review and adjustment 2020.
Okay, so you look at our current facility fee is structured for the daily room rate for skilled care is $305 for a private room. And then the intensive skilled care is at $342. We're looking at raising that up to $335 for the skilled care and $370 for intensive care. And the third page is local facilities and what their rates are. Almost all of them are higher than us, except for one. And they're all higher than what we are actually projected to going to. So we thought it really is a needed increase to, and this increase is already figured in with the budget. And so that increased number is used to help us offset what we were doing in the budget. So,
Some history.
Okay.
Because you haven't been here.
yep,
So this would come before our committee every year,
yes,
and they would do the same kind of comparison chart. And I think the most we ever raised in 1 year was 2%. And this is only for private pay, is that correct? It's still going to that?
yes.
Okay, so 2%, and up here, unless I don't read this right, you're looking at 9%?
That's correct.
And then so that's history. And maybe we were wrong, and maybe we were right. We had 54 residents and maybe 14 and sometimes we're private. some of these other rates for some of other facilities have reasons why they're higher or why they're lower. Evergreen always seems to be higher.
These are all private, aren't they?
Well, Brewster isn't. Brewster is the Outagamie County one.
Yeah.
So this is not a horse race to see which county-owned facility be more higher than whatever, because Brewster's Brewster. I get that. On-road care is on-road care. They can't give people an on-road care, and then when they get them, they just pull them back out. So it's not the greatest place. So I always throw out evergreen and on-road, and I kind of listen for the other special. I think that Eden Meadows is a very nice place. But the only one here on this list that I see, I don't know what Peabody is. Brewster is Outagamie. I get what everybody was saying, but we have a lower census too, so now the private pay individuals who are usually county residents, whether it's Brewster or
Ms.
Park.
Gabbard,
have to pay that.
Peabody is up by Lawrence. And that-
Is it what?
It's located up by Lawrence University, by the
Is it private?
football field. It is private.
That's special.
Specialized private? And I guess what
I think it's specialized on care.
Yeah.
Maybe the ones down the street on Owen Road, what's that called?
I got it.
It's actually Edenbrook. Yeah, that's not in here, but that's, and Brooklyn, part of kind of a franchise where they have separate locations.
So you can keep raising the private rate as much as you want. I mean, whatever. It's still, you have to be sure you have private pay in here to reflect that someway. I don't know, I'm torn about this one. I just,
Well, I mean, the reality is that our bread and butter is getting from a different type of client, right? So the idea is that you have a private pay set so that, you know, there is someone who can afford to do that, can come in, and we have that right for them to do that. So it's good to be, I think it's good to be kind of in the middle of who your local entities are. I don't want to call them competition because we're not really, they're not competition. But I mean, that's the one thing that I noticed. If you look at like what Eden Meadows, Evergreen, you know, is not one because they have a nonprofit organization, they have really good endowment, they have internal funders who are, you know, contributing to that as well. And so it's completely different. And our care, you know, is what it is. It's in my opinion, we're on a much different level. And that we provide a much better service. So that probably has to stand by. So, but so I think setting a private pay number that's in between our own local outliers, I think is a really good practice to do. So, so that's just my opinion. I guess my opinion.
Toby, I don't know if we're looking at this without understanding that we're still in the beginnings of a wage study that isn't going to be done until after the budget. It won't be finished until after the budget. I've talked to Mike Kohler, and I've talked to Mark Hibbett, yeah. And they have continually said it's coming, it'll be here. But by the time we get to the budget, it still won't be done. I can believe that. And you have to, I guess, put your faith in it's going to be a decent wage increase for everybody because we are not to those levels, nowhere near the levels that we should be in, say, paying nurses or paying people over in the highway department or whatever. And they're all screaming and they all know the wages, the wage study is out there. It just hasn't been completed. So I just come back at the numbers and say, you know, we need to scream in John Damel's ear about this because this deals more with the wage study, the argument that the wage study is going to be done, and the argument that we're not making enough money so that we can. The people are not making enough money so that we can justify higher costs for the patients in the increase in the patients that we want to take in. When you contract with a patient to come in on long term, do they have any, I guess this is Doug, do they have any agreement that they sign on that once they get here, they never see an increase in the cost of their care?
No. No, it's adjusted every year, or it can be.
That was gonna be my question, is this a normal practice? Looking at comparables and then
Yeah,
can we do that on an annual basis?
every year at this time. Yep. Usually in July, I think. Yeah.
For next year, because that's when the wage study will be implemented for 2024.
Yes.
This might be a little bit higher because of that.
Mhm.
Sure.
You know,
It'd be more justified.
not well,
I mean, you'd have numbers out there that would back.
Well, right now, we're looking at, inflation of 9%. So all of our costs are 9% higher for supplies, food. So that's what we're trying to cover here. And not so much the actual wages, but more the outlying items.
Yeah, you got it going both ways, and the effect on the employees outside. Remember, you're a business that has to show a profit before you can start passing it on to the employees. And if you start passing it on to the employees and you stop making a profit and you start running on losses, you're not going to be in business very long, that's for sure. So.
Did the state, when you were doing the budget, I thought I saw a line in there, I'm gonna backtrack, but it has a point to get to this. The Medicare money we get that's gone up.
That'll go up a little bit too, yeah.
a little
They,
bit, but-
um,
So of course we're getting money.
let's see, so,
I thought I heard
so the
you say
Medicare,
you had a
the Medicare Advanced, we have projected as a 6% increase, or no, 6% of budget. Let's see, I think that, and
So daily, right on that. 219 up 15 from that,
which,
and Medicare paid on your budget for 2023. Daily rate estimated 219.
for
For Medicare.
Medicare, oh,
Oh, that's right. No, that's not.
That's, yeah. Yeah, so the actually Medicaid Title 19 daily rate is at $219, and they're actually projecting that's going to be up $15 from prior year. So,
So one government entity to another government entity, we're gonna give you $15.
more per resident, no, per day. And
Any more discussion about the private pay rate review and adjustment? On the move to a motion?
Move to approve, private pay rate adjustment. Thank you.
Any more discussion?
All the stuff in the next layer, and people, the measure and.
Under the remarks, Medicaid Title 19, 219. That's right, thank you. Okay, if there's nothing else, we'll take a vote on the private pay rate, 2023. Say aye if you approve. Aye. Aye. Nay if you disapprove.
Aye.
Four,
Aye.
one,
And
oh, I'm sorry. Dave with a 10.
Name with an N.
Okay, yes, more than one. Okay. All right, thank you, everybody. Item number 8, discussion and action, budget $1,600 from general fund for increasing costs. Industrial dishwasher, main kitchen.
so this is the quote that they just came through with, updated quote on 6/24. So if you looked at it, there was the one item, the first option was for $117,000. Second option was for $113,000. And they said if we didn't have it started and approved by September 1st, it was going to be I think, what they say, whatever that increase is, I think it's 6 or 8%.
600, whatever.
So then option 1 goes up to 121,000. Oh, no, 121,000 would be the total of the original with the shipping cost of $4,000. 128,000 would be the new cost of the item, and then 132 would be with the shipping. So we have and we're actually planning on doing the second option. So the $113,000 machine, because it's just a little bit shorter. So that's why they want that.
Light type.
And then with the shipping, it goes up to 128,000. So with our original 100,400 plus this budget transfer of 29,006, that'll give us enough to make sure that we got enough to cover the cost of the whole project.
So
Option number 2.
Model EUCC6.
17 feet long. The option 1 is 18 feet long, so I just thought that 17-foot one would fit better in the kitchen area.
do we have to remodel any of that space?
Nope, it'll fit right exactly where the old one is.
And so, and they will install
They will install.
it, and that's what that's 4,000 is there?
That's the cost of all of it includes the installation.
Okay. Actually, this is
Uh,
It's 24 wide. Up there.
Yeah.
For the belt on the bigger one is 29.
29 wide, yeah.
Any other questions?
Second. Did I hear him say a full motion or did I hear him mumble?
Yeah, we have a motion from Supervisor Gordon to approve the budget transfer to $29,600. Second from Supervisor Thomas. Any further
Just a
discussion?
quick question for Doug. So this won't come before the board until the September meeting.
That's correct. We
But with us saying this, we can call them and
say that say that
give
we're,
them some kind of,
It's firmed up, but.
Yeah.
we-
until it's actually approved by the county board, then we can't order it.
Your jurisdiction is whatever we vote. And then it comes to
I know.
Comes to me.
He just said if you don't get word of this by September 1st, it goes up.
Well, that's the 128. That's already figured into the number. Yep. Yep.
Yeah, okay.
So
Okay,
you want to vote?
All right, yeah, any other questions?
that's it.
All right. All in favor, say aye.
Aye.
All opposed, say nay.
Got a 5-0.
Carries 5-0.
All right.
All right, item number 9, suggest topics for future meetings. Anything going on with the committee?
I have one, and it might even be a little bit late, but we'll do that at some point. Morris and I sit on the ARPA strategic outcomes committee. And one of the things that we're looking for is to gather information from departments in regards to things that they may see as relevant to communities. So I'd like to just kind of advise staff, kind of put together a list of things that they feel would be beneficial to be covered through the pot of dollars that we have, but also kind of fit into that. You know, more made a point of this, but to make sure it kind of fits into that definition of what our budget is and how it's beneficial to fill those needs and those gaps that were created in the last.
And to add on to what he has to say here is that I do have the do's and don'ts for making that list up. So if you need to have a copy of that, I'll try to fire one on.
Yeah, no, I've seen the regulations and the amended regulations and the,
I'm gonna temper that one, because we actually, as a committee, haven't approved what that is yet at this point, but just agreed in spirit that we would want it to be kind of kept in that area.
Well-
How often are we to be?
Let me flag that whole thing. What we just got through saying is that the ARPA dollars have been already covered by the losses that the county has had over the past year and a half. And that money is most likely going to go directly into an account with ARPA on it. And then as projects get approved in the completeness of our committee, we will then peel those off in procession as they're appointed, and we give them a priority. And I'll be handled that way, I'm pretty sure, but we want to make it as close to the requirements of ARPA in the event of somebody turning around and saying, well, we haven't followed the rules quite significantly, and we want to check all of these things, if somebody comes along and does an audit. And that we
You'll
don't-
have an audit anyways.
So we are putting in meetings with September 12th before the whole night.
I believe that's the date. That might be the actual 15th.
I mean, are you gonna indicate that to other departments or committee? I mean,
As we talk and as the exec talks to the various departments, I'm sure that will be,
I'll let you know, we got meeting tomorrow morning.
It could also be the director of administration. that engages in that conversation.
right.
I did receive something, I know Mr. Egan, must have been conversing with, the fire chiefs of the county. Of all the fire department, about 5 things.
Yeah.
We're getting that information.
Pass that bulletin to everybody, I'm sure.
Yeah, yeah.
I have a project that, that I'm working on right now. We're still gonna be bringing that to the board to get any kind of approval before we go into what it's going to be, but it's from up in Fox Crossing.
Any other topics for the future?
the only thing, like, I know we talked about budget and add-ons, obviously, but then you'll have your meeting, contact it, but then you directly, if we hire, when you want to pursue any of those add-ons, I think we would have to have someone with support or the director or his committee, so maybe we want to think about looking at, maybe, I don't know how to word it, discussion, possible action, in that, making the amendments to the budget. I think, so, give record time and.
You're talking about these add-ons.
Yeah, and a couple of them, maybe, we learned about 2 of them like last meeting, maybe a couple of them we can learn about, talking about, the others maybe learn a little more about, and I will pursue what I can do about the park center or whatever with the lawnmower, and maybe we can find out more about that too.
And yes, most of these were, I think we received a presentation on all of them, except for the coffee. You want our wonderful. All right. Let's see, any other suggested topics?
Just keep up with that census report, that's important to me. I appreciate that.
Mhm.
All right, our next.
So if we can do residents.
I think September 2nd, I believe.
And that kind of my actually got thinking, my experience is, is I was in rehab, we haven't had a rehab.
Well,
Neighborhood for a couple of
yeah.
years, so we won't have, maybe we have people rehab, they're spread out and they've been here a long
Yeah.
time.
Yeah.
That was one sort of big thing.
Yeah.
People who, to me, was not to say, like, we're missing.
Yeah, we do have rehab people spread throughout the building, they're not in the wood one like they used to be.
And they wouldn't be living in this.
So just in the sense of openness and transparency, I want to acknowledge that Morris and I sit on a committee together. And it's not listed at the bottom of our agenda. And so in the future, we want to have the ARPA committee also. be noticed.
I think the reason for that is that it is simply quorum and the ARPA committee is much larger. So the two of you plus two or maybe 3 more people would be needed at least, right? Before there's a quorum, but I can check into that.
Yeah, just to kind of cover our bases on that, because we have a very open conversation here. So
Oh, and you're worried about that,
I'm not worried about it, I just think it's
but the aviation and information. That was pretty good.
All right, next meeting date, September 15th, at 3:30, okay with everybody?
Is that?
September 15th.
Thursday.
Yeah, well, I mean,
got an IS meeting at 5 o'clock.
It's not,
Where is that?
I'm gonna say this, is there any quality?
Where do you have to-
Probably in the can. The refrigeration.
All right, well, we will we'll that's our meeting, make sure that we'll stay on focus and we'll come to be done. 4:30 then.
And definitely probably have me. That's why we're right. That's why I emailed you, Colby, Monday, or whatever, I know we're having a meeting for sure, and then I got the pack. That's one reason I get a pack.
I'll make sure we get, I'll make sure that we also get at least on the calendar, the date held.
Looks like, she actually sent out the wrong date, it's actually the second Thursday. She put down the 14th. Yeah. so the second Thursday.
Right, then we come to item 11, adjournment.
Move to adjourn.
Second.
Chairman, all in favor, say aye. Aye. Opposed, we're adjourned. Thank you, everybody.
You have my number?
All right, stop and